Qader, and we are thrilled that he is here. Hamza is a critical care float registered nurse with 6 years experience. He worked in various hospitals and ICUs across the country. Hamza is a Palestinian from Ain Karim. I'm not sure exactly where on the map that is, but he lives in Chicago. Hamza went to Gaza with PAMA, PAMA, Palestinian American Medical Association, and he was stationed at the European Gaza hospital in March of this year. Hamza, thank you, if you would please stand there. We'll get Hamza's thoughts, and then we will proceed. Thank you.
Assalamu alaikum, everyone. Good evening. Can everyone hear me okay?
Yeah.
So my name is Hamza. I'm an ICU nurse. I've been an ICU nurse for about 6 years now. I live in Chicago. I've been in Chicago my whole life. I'm Palestinian from Hamza. I'm not going to go too much into the facts that we're here. I'm sure you're all aware of what's been happening. So I'm just going to kind of briefly talk about my experience and how it's drastically changed since I left. So I had the privilege and honor of a lifetime to go with PAMA in March. I was there in the European hospital from March 4th to March 18th, 2 weeks. Unfortunately, the European now is completely abandoned. It has been completely evacuated. The patients that were there, the refugees that were there, are all gone and dispersed. I was just talking to one of the colleagues, one of the ICU nurses, one of the surgeons that I worked with there, that what happened. They were sending me videos. And when I was there was 30,000 people in that compound. Typically, this is a 300-bed hospital, 200-bed hospital. So most of these people, most of them, 99%, were refugees who had nowhere else to go. Patient rooms that had approximately space for one patient would have about 4 to 5 patients in these rooms with their entire families present. Some of these patients were discharged 2 weeks ago, 3 weeks ago. But where did they go? The entire compound, so there's a school of nursing, and there is the actual hospital. Everywhere you go, no matter where you walk, there are tents. People just live there. When you're walking through the hospital, in any hospital, anywhere you go in the world, you don't have people living in staircases. You don't have people living in the hallways. The only thing that separates these patients from everyone else is literally their bed sheet. So imagine bed sheets in the hallways and staircases. That's how they live. And what makes the reality of that sadder is that those people, how they describe the people on the ground, is that they were living in Jannah, which is to them paradise, because at least they had walls around them. At least they had running water in the hospital. At least there was electricity, and at least there was some Wi-Fi, whether it be an hour a day, 2 hours a day. So as a critical care nurse, my best use would be in the ICU. So when I got there, they had 3 ICUs. Their main ICU, their cardiac ICU, and then an overflow ICU. There is no level of preparation that you could have that could prepare you for what you see. So I'm Palestinian. I'm very aware of Palestine. I'm very aware of Gaza. I've seen the worst of the videos. I've seen the worst of the pictures coming from all various sources. So I went in there with as little expectations as possible and expecting the absolute worst. So when I speak, when Dr. Thad speaks, when Dr. John speaks, everyone that goes and they speak, there are no words, there are no videos, there are no pictures that can depict and accurately describe the level of destruction and how horrific the situation actually is. So when you get in there, it became crystal clear how bad it was from day one. There was no soap, there was no sheets, there was no infection control, there was absolutely nothing for me to be able to do my job properly. And in a hospital, what do you do when you don't have disinfectant, when you don't have soap, when you don't have the basic necessities to take care of patients? We would have to run around to try to find certain wound care equipment. We had a patient, for example, who had a significant wound, a fasciotomy, so his right leg at the bottom was completely exposed and open. So here in the States, we have something called a wound bag where you cover it up. We don't have wound bags. We don't have anything. So what we have to do is we have to scavenge up some supplies, get as much sterile equipment as we can, and we have to rig up and call engineer and have them rig up the suction on the wall to try to MacGyver this for it to work. ORs are so backed up that people are waiting and dying because they can't get access to care. Basic procedures couldn't be done. There's not enough anesthesiologists, there's not enough surgeons. So we were having to perform actual operations in ICUs. For example, that same person that was in the ICU, he had to have a degree, which is basically cutting away at tissue. I know this is extremely graphic and I'm very sorry, but I need to kind of demonstrate the level of how bad it was. And we would have to go to the OR, borrow their equipment, and do this to patients while they're awake. We didn't have enough anesthetics or sedation to put them to sleep to do this. So we're carving away a man's leg while he's in and out of consciousness because we can give him the ketamine that we had because we had just run out of fentanyl and morphine the day before. And we're carving away his leg while he's awake and he's screaming. And this is the most functional hospital. It was the most functional hospital in Gaza when I was there in March. It's only significantly gotten worse since then. The EGH is no longer functional. There are no functional hospitals. Healthcare in Gaza has been completely destroyed. So some of the main takeaways that I took from my experience there is that the numbers that we were hearing, like I came home with this fear and suspicion that we were horribly wrong with the numbers. And recently the Lancet came out with that report. I was struggling for months trying to figure out there's no way we're right. The level of destruction, every person I talked to had 2 dozen, 3 dozen, 4 dozen people from their family killed. Things destroyed everywhere. Over 100,000 tons of bombs dropped. Now, for every ton killed one person, that's 100,000 people. So how are we at 30,000? How are we at 40,000? Then you see the level of destruction. The infrastructure in Gaza is completely destroyed. There is no more schools. There is no more education systems. There are no more functional hospitals. Anything that you could imagine that creates a society is completely gone. When we went outside the hospital to kind of go to the camps to see what life was like there and how we can contribute there, nothing on earth could have prepared me to see the conditions that they were living in. Children running around without shoes, clothes that they look like they've been wearing for months. Then no water, no facilities, no bathrooms, nothing. And most of these people barely had food to eat, or if they had anything to eat at all. Some of the people that I talked to hadn't seen meat in, I think it was, 6 months at the time? Nothing. And the second thing is when Dr. Thad and Dr. John were speaking at a panel before I got the opportunity to go, and they had mentioned that the rebuild of Gaza was going to take decades. And they were kind of the nudge that pushed me to make my decisions of how to go. So the real work really does start when this is all over. But the most impressive thing, and I don't want to take too much time because I know Dr. John wants to speak, and I really want to open up for you guys to ask questions. But working with the staff in Gaza was one of the most heartbreaking and most humbling experiences I've ever had in my entire life. So people like to introduce us as heroes and as whatever. I cannot accept that title because working alongside those people, with the people of Gaza, they are the true heroes. Here's why. You have nurses, doctors, surgeons, respiratory therapists, volunteers that have been working nonstop now for 9 months. Most of the staff that I worked with were previous staff members that showed up in Indonesia, Kuwait, and so many other hospitals that they worked their way down. Some of them were actually some of the staff members that were abducted from these hospitals and held hostage for 2, 3 weeks, 4 weeks, a month at a time, and then dropped off, separated from their families. I would estimate that 80 to 90% of the people I talked to were volunteers. They weren't getting paid at all. So they were doing this for free. And they went from hospital to hospital to hospital to take care of these patients. The ones that were getting paid at the time, they were making $200 every 50 days. Now I want you guys to imagine what $200 is every 50 days. And I want you to know, on top of that, imagine in a situation where at the time, a bag of flour in the north was $800. So, despite the level of destruction, despite all of this, they showed up every single day. And we worked with one of the OR nurses. Her father and I think 3 from her family were killed the night before. So she took that night off. She was at work the next day. She showed up every day. Every single day. They showed up and they did their absolute best. And the harsh reality is that without us continuing, and I know it's exhausting after 9 months, without us continuing to push and shove, that every single day that passes, it only gets substantially worse. Like the Lancet reported, the indirect deaths are about 5 times more than the direct deaths. Every day that passes, we're dealing with dozens, if not hundreds of people that will die long term. The chronic malnourishment, the lack of aid, the basic necessities of just pain control. Like, I can't get, and I truly cannot get some of the screams that I heard there on the ground while we were doing basic things out of my head. With that, thank you so much for inviting me.